looks odd, it doesn't age well, and it just doesn't look natural. So if you have laxity, looseness, heaviness in your neck, and some mild jowling, then a neck lift may be a solution for you. So a facelift includes a neck lift. A neck lift does not include a facelift. Should you get a facelift or a neck lift alone? That is the big question that a lot of people have, and I'm gonna give you the answer. So hopefully by the end of this, you'll understand. So if you like this type of content, like and subscribe for more, and I look forward to seeing you guys for future videos. So let's get into the difference between a facelift and a neck lift, what it treats, who's a good candidate, and what are the best treatments for you. So let's start with a neck lift. So a neck lift, a surgical neck lift, is a deep plane neck lift, a isolated neck lift. There's a lot of different terms out there that are used to describe it, but essentially what it is it is an incision under the chin, as well as incision behind the ear, and sometimes a little bit of a small incision in front of the earlobe itself. This is typically done for individuals that have laxity, looseness, fullness, heaviness within the neck alone, that do not have aging changes within the face. So if you have aging changes within the face, a neck lift is not going to improve that. Let me explain what exactly the neck lift treats. So a neck lift will slightly improve the jowling. The jowling is the collection of fatty tissue and laxity of skin along the jawline. So it will help to improve, strengthen, define the jawline. It will also help to remove any laxity, laxity in your neck, looseness in your neck, heaviness in your neck, extra glands, extra fatty tissue, those types of things. So if you have laxity, looseness, heaviness in your neck, and some mild jowling, then a neck lift may be a solution for you. These are typically individuals that are in their 20s, 30s, and 40s. Beyond that, there is significant aging changes within your face that it is necessary that you do a facelift. So a facelift actually includes a facelift as well as a neck lift. So all facelifts that I perform are extended deep plane facelifts, which are advanced surgical procedures that help to lift and reposition the laxity or the extra laxity of tissue within the face, as well as strengthen and tighten the neck. So that's where the convergence kind of occurs. So a facelift includes a neck lift does not include a facelift. So let me explain why more often than not, you are a better candidate for a facelift, a lower face and neck lift, as well as a neck lift, rather than just a neck lift alone. The reason is because of the platysma muscle. So what is the platysma muscle? The platysma muscle is a muscle that starts on one side of the neck, goes to the other side of the neck, starts down at the clavicle, and actually transitions into the face. This muscle separates the superficial layers of the face and the neck to the deep layers of the face and the neck. This layer, this muscle, connects to the SMAS layer. You may have heard of that before. This is called the superficial muscular aponeurotic layer. What does that mean? That is the glide plane within the face. That's the plane that when you move this, you can see that it can glide and lift and reposition. The deeper structures are not within that glide plane. So that SMAS layer is the glide plane. So because it connects to the platysma, which is in the neck and the lower part of the face, if you have aging changes of the platysma, you will often have aging changes of the SMAS, which is seen by heaviness in the cheek, significantly more jowling, separation of the cheek fat, basically the high cheek fat and the lower cheek fat. Those are in laxity along the jawline. Those are the findings that are typically seen when you have facial aging as well as neck aging. So that's important to understand because most people that are coming in, even in their 50s, they'll just be really bothered by the heaviness of their neck. But if you just tighten their neck and lift and support their neck, you're gonna miss out on addressing and helping to improve any of the aging changes that are within the face. And because this is a contiguous muscle layer glide plane, it really is important to do these together because it's a single unit and a single piece. So it just doesn't really work when you have enough aging changes in the face to only do the neck. It looks odd, it doesn't age well, and it just doesn't look natural. So I hope that makes sense. I hope that sheds some light into what it entails, the difference between a neck lift and a facelift, and who's a good candidate for one and who's a good candidate for the other, and why sometimes you may think that you just want a neck lift, but I actually recommend a facelift and a neck lift to really give you the best results. So get a consultation, talk to a professional that understands your anatomy, understands what's right for you, and that really can give you the best possible outcome. So if you have any other questions, leave them in the comments. If you've had any experience with this, leave it in the comments. I'd love to hear about your experience, and then like and subscribe for more. And I look forward to seeing you guys for future videos.